Hi, good evening. I am Dr. Pranavan, consultant forensic pathology teaching hospital Jaffna. Today we are going to see the topic infanticide, and we'll go for short introduction as well as exam question, most of the exam question. So killing of a young child by the mother is a well-recognized medical and psychiatric phenomenon. So killing of a young child by the mother, here is important, young child by the mother. And this distinguishes the type of crime and differ from the other type of homicide. So we know that killing of one person by another person amount to homicide. So here, when the mother kills his own young child, that differ from the homicides. Therefore, the penalty is different. So we must understand, since it is different, the penalty is different. So usually, homicide or murders, that is planned homicides, the penalty is death sentence or life in prison. But when the mother kills his own child, the penalty, the courts decide it is not the homicide or murder, it is coming under the infanticide. So today we are going to see what is this infanticide. So the definition of infanticide is killing of a child under the age of 12 months by mother while the balance of her mind is disturbed because of the effect of delivery or lactation. So here every point is very important. Killing of a child under the age of 12 months. If the child is under the age of 12 months only, that is amount to infanticide. That's under the age of 1 year. And by the mother, here the killer is only the mother, not the father or any other family member. While the balance of a mind is disturbed because the effect of delivery or lactation. So if you take Sri Lanka, there is no separate infanticide act. Sri Lanka has no infanticide act. It's covered under section 293 explanation 3 and 294 exception 5. But if you see UK, they have a separate infanticide act. So infanticide must be established. The child showed signs of life after complete expulsion from the maternal passage. But since there is no separate act in Sri Lanka, it is not necessary to establish that there was a complete expulsion of the child from the maternal passage. So Sri Lanka, there's no need for the no need to establish the complete expulsion of the child from the maternal passage. But in the UK, you have to prove that child has come out from mother before being killed. In Sri Lanka, it is not necessary to prove that child has come out of mother's expulsion from the mother's womb before it's killed. So we will see this in detail. So what is the medical evidence in the case of alleged infanticide? The main criteria to establish a child was born alive and was alive at the time of being killed. This indirectly involved the establishment or exclusive the stillbirth. So here our main target is to prove child was born alive. Second one is that child was completely brought forth, or at least part of the child brought forth at the time child was killed. Second one is that we have to prove that at least part of the child came out from mother before being killed. Third one, deliberate act of commission, strangulation or stabbing or something, or omission, failing to feed the child or keep warm, leading to the death of the infant. So these are the main criteria to establish. First one is to prove the live birth without any stillbirth. Second one is a part of the child or complete child came out of from mother. And third one is there's a deliberate commission or omission. These are the medical evidences to establish. And fourth one is the most important. The age of the child is less than 12 months. The age of the child must be less than 12 months. So how to ascertain the signs of live birth? How do we prove the live birth? Respiration, feeding, vessel changes, coat changes, skin changes, blood changes, and reaction to trauma. So these are the theories. I just go through fast to start the question. Next, we'll start the question. So how to ascertain the signs of live birth? Respiration, feeding, vessel changes, coat changes, skin changes, and blood changes, and reaction to trauma. So now we are starting, students, we are starting the questions. Infanticide is an exception to the charge of murder. So what is the answer? Anybody? Infanticide is an exception to the charge of murder. Somebody please answer. You can even send the message. Yes, it is true. Why it is true? We already said. So infanticide is a killing of a young child by the mother is a well-recognized medical phenomenon. So, and this distinction type differ from the other homicide, and therefore penalty is different. So we know this penalty is different. So it is true. Is the charge level only against the dead infant's biological mother? So what is the answer? The charge is only against the dead infant's biological mother. What is the answer? Anybody? So I already told the infanticide definition. What is the definition? Killing of the child. Definition is killing of a child under the age of 12 months by mother. So if the mother did only, it came as a infanticide. If somebody else did, it is not infanticide. It is a murder. So it is only against the death infant's biological mother. True. Is the form of homicide? What is the answer? Anybody?
No.
Force. We already, it is not a homicide. No, it is not homicide. Is applicable only in the case of child less than 1 year of age? Simple. What is the answer?
Yes.
We already seen this.
True.
True. Is a result of child battery? This is very important. Is a result of child battery. Anybody? What is the answer? What do you mean by child battery? It's an alternative term for non-accidental injury or child abuse. So infanticide and child abuse, is there any relationship? Child abuse is a different topic. Child abuse is child being treated unacceptably by the somebody at a given circumstance. That is different. But infanticide is entirely different. Here the mother killed the child. So child battering is different from infanticide. So it's a result of child battering is a wrong, false. It is not a result of child battering. It is due to the psychological consequence of the mother. Is it understandable to everybody? So result of child battering is false. So next question, true or false regarding infanticide? Hydrostatic test performed to assess the live birth in a putrefied body. Anybody who studied infanticide? What is the answer? Anybody knows about this hydrostatic test? So we will see what is hydrostatic test. Hydrostatic test means this is based on the specific gravity because in respired lungs will float in the water while the unrespired lungs will sink in the water. This is very simple. So if somebody born alive and if there's a respiration, lungs weight will be reduced because of the air. So that lungs will float in the water. But if the lung is not respired, it will like a solid organ, it will sink into the water. That is called hydrostatic test. So what is the problem in hydrostatic test? There is a false positive and false negative results. Why? When the child born, there may be a resuscitation or artificial ventilation. In such condition, even child born dead, you are resuscitating and there could be a chance lungs can be ventilated. breathing may occur before the expulsion of the baby from the genital tract. While child is on the way to out in the genital tract, breathing can happen. And third one is the very important, putrefaction changes. What is putrefaction changes? After death, if body putrefied, gas may be formed in the lungs. So in these conditions, it can give a false positive results. So hydrostatic stress, of course, is ascertain the live birth, but we have to aware these under these conditions, there may be a false positive. So this is hydrostatic stress. You can see the lungs are floating. Lungs are floating in the water. So is it clear to everybody? So hydrostatic, so what is the stem? Hydrostatic test performed to assess the live birth in a putrefied body. So what is the answer now? It is performed in the putrefied body? No. In putrefied body, it will give a false positive result. So only in the fresh body, it has a value. So this is false. Hydrostatic performed to assess the live birth in the putrefied is a false. Presence of milk in the stomach exclude the charge of infanticide. What is the answer? Anybody? Presence of milk in the stomach exclude the charge of infanticide. Any idea? Anybody who willing to answer this? So if the milk present in the stomach, what does it mean? Feeding has happened. So if the feeding has happened, what does it mean? Child was born alive before the death. So it is a confirmation of live birth. So you are doing a post-mortem and you are finding the child's stomach, there's a milk. How the milk can reach the stomach? Only by feeding. So if the child was fed, what does it mean? Child was alive. So if the milk in the stomach, that confirm the infanticide. So it is not exclude the infanticide, it confirm the infanticide. So this is again false. Is it clear to everybody? It is a sign of live birth. Any question you can ask from me, no issues. The viability of the child is not essential in the courts. Anybody want to answer this question? What does it say? The viability of the child is not essential in the courts. So if we have seen in the Infanticide Act, what does it say? In Sri Lanka, there's no Infanticide Act, but the UK, there's an Infanticide Act. I already told this. So UK, you have to establish the child shows signs of life after complete expulsion from the maternal passage. But in Sri Lanka, since there's no Infanticide Act, you don't need to prove child was alive or not. What does it mean? That child, you don't need to prove child was completely taken away from the mother's maternal passage. So here the stem is viability of the child. There's nothing mentioned about the viability of the child in the law. It only talking about killing of a live child. So even the child has some congenital condition, child is born alive and killed by the mother, it is infanticide. So viability is not an important point in Infanticide Act. Only we check whether it is a stillbirth or not. And when the child was killed, child was alive or not. Is it clear to everybody? So viability of the child is not essential in the courts. Yes, it is true. It is not essential in the courts. Courts never ask the viability. Court only asks whether child was alive at the time of killing. That's all courts are. It is a bit difficult. If anybody don't understand, please ask the question. So viability of child is not essential in the courts. True. Evidence of live birth is most clearly seen in the respiratory system. Anybody wants to answer this question? Evidence of live birth is most clearly seen in the respiratory system. Again, it is false. Why? Respiratory system, we already seen the definition. Even the child comes through the mother's womb, there may be a respiration, even before child born. So it is not a clear evidence. And there are so many problems in the lungs, artificial ventilation, purification, which also can mimic as a respiration. So respiratory system is just an indicator. It's not a clearly seen. So circulation is a good indicator. Respiration just clearly seen means it's false. If the child is less than 12 months old, the father can be charged for infanticide. What is the answer? Anybody? It's simple. False. I already told. Father, there's no infanticide, only murder. Infanticide only for who? For the mother. So father can be charged with the infanticide act. Is it clear to everybody? Up to this, anybody have any doubts? You can please ask. There's no worry because these are difficult questions. Any doubts? Okay. In the absence of doubt, we'll move to the third question. Findings suggest the occurrence of infanticide. Macerated fetus. What is the answer? Very simple. What is the answer? Macerated fetus. What do you mean by maceration? If you studied the notes, you know. What is macerated? So, to answer this question, you should know what is macerated fetus. So, we'll see what is macerated fetus. How to diagnose the intrauterine death. So, maceration or not is the main thing that when the child died intrauterинely, child become macerate. Baby becomes soft, flaccid, and flattened when the child when light, skin brownish red, peeling, rising into blisters. So if you see the photo, you will understand. These are the maceration features of macerated feature. So when somebody died intrauterine and born, it's look like this. So you can see soft, flaccid, and flattened blisters with a blister. These are the features of maceration. So when you find maceration, it is the end of the infanticide investigation. Why? It confirms the child already dead and born. So it confirmed the intrauterine death. So infanticide investigation is immediately over. So what is the first sign of maceration? Skin slippage. And then fluid-filled bullae appear and skull bone abnormally loose and overridden. Skull become loose and overridden. So now you can understand. This is the maceration. Is it clear to everybody? So this is macerated fetus. So what is the step? Finding suggestive of occurrence of infanticide. So what is the answer? Macerated fetus. False. Is it understandable? So macerated fetus means intrauterine death. There's no infanticide. Massive diaphragmatic hernia. What is the answer? So what is that? It's simple. If diaphragmatic hernia, is it infanticide? No. What is the answer? No. False. Okay. It is not suggestive of occurrence of infanticide. Nail mark in the neck in home delivery. This is very important. If you have studied genomes, you will understand. Nail mark in the neck in a home delivery. So what is the circumstance? Here home delivery. Home delivery, is it possible to get the nail mark in the neck? Yes, self-delivering. If somebody deliver the child on her own, or the home people try to pull the child out, there may be a nail marks in the neck region. Home delivery. So it doesn't mean it is an infanticide. So you have to do the autopsy and confirm the strangulation. Nail mark alone in the neck doesn't mean it's infanticide. You should understand. It can happen in home delivery. Is it understandable? So nail mark in the neck is not a proof of infanticide. Multiple skull fractures. What do you think? Multiple fracture of the skull. Anybody? Yes, true. Why? So infanticide methods Blunt trauma is one of the main method. The mothers usually assault the head, how dash into the floor, thrown down or blow with a weapon. Usual finding are skull contusion, laceration, skull fracture, intracranial hemorrhages, anything. But mother can come to the courts and say it is a precipitated delivery, child suddenly born and fall into the floor, or birth trauma, or instrumentation, fall from the hands while crying. I have seen case like this. Mother usually say, child fallen from my hand. So these are the defense. But usually we can differentiate that. So blunt trauma is one of the method of killing the child. So it can lead to multiple fracture of the skull. Anencephaly of the fetus, is it suggestive of occurrence of infanticide? No, it's a natural condition. It's a congenital condition. Is it understandable? It's a congenital condition. So it is not the suggest the occurrence of infanticide. So regarding infanticide, fourth question. And advanced putrefaction causes loss of all evidence of live birth. What do you think? Just think and answer. Advanced putrefaction causes the loss of all evidence of live birth. So advanced putrefaction can cause some evidences. What is in the lungs, you can't do the hydrostatic test, but it is not causes loss of all evidence. For example, stomach milk may be present, circulatory system present. So it is false. All evidence means false. Killing of a child less than 12 months old by father is known infanticide. What is the answer? Anybody? Simple.
False.
It's false, no? Why? Mother. It is mother. Penalty comes under the culpable homicide not amounting to murder. Yes, it is not amounting to murder, exception. Okay, culpable homicide, exception. So it is not amounting to murder. What do you mean by murder? Murder means you are planning and killing somebody. You have an intention and kill somebody. But in infanticide, the intention is not there. Mother has psychologically affected. So it is not coming under the murder. It's an exception under murder. The mother should be proven to have pre-existing psychiatric illness. This is a very good step. Anybody who studies psychiatry, what is the answer? The mother should be proven to have pre-existing psychiatric illness.
False.
So in the Infanticide Act, we study mother's mental status is disturbed by the effect of pregnancy or lactation. But what is this stem say? Mother already having a psychiatric illness. True or false?
False.
This is false. Very good. This is false. Why this is false? Mother not necessarily have a psychiatric disease. So here, the mother may be a perfectly normal mother, but his mind is disturbed due to the pregnancy or lactation. So it is false. Very good. So next time, hydrostatic stress confirm the live birth. Of course, in a normal situation, hydrostatic stress confirm the live birth, true. But it is not true in putrefied bodies. Here it's very clear. Hydrostatic confirm the live birth, true. Okay. The fifth one, infanticide done by the biological father. What is the answer? Again,
False.
same. False. By mother. Positive flotation test suggestive of live birth. What is the answer? True. I already told. Positive flotation means when the lungs float, it suggests the live birth. Deliberate exposure to cold environment is the method. What is the answer? Yes, you can expose to cold, or you can avoid the feeding. So children are very prone to get cold. Why? They have less fats. If you are not wrapping the children, they will die of cold. So deliberate exposure to the cold environment is one of the method of infanticide. So it's true. It is exempt from the culpable homicide amounting the murder in Sri Lanka. Again, the same step we have seen. It is exempt from the culpable homicide. Yes, amounting it is true. It is not murder. It is exempt. Macerated fetus exclude the infanticide. What is the answer? I just explained. True. Is it understandable to everybody? Do you have any questions up to now? Okay. This is bit weird question, but it appear in your question paper, so I have to teach true false regarding the radiological signs of fetal death. Overlapping skull bones. So we will just see what are the radiological signs of fetal death. We will just see short notes. Okay. These are the radiological signs which is appearing in the screen. Okay. First one is a Spalding sign, overlapping of the fetal. Here it's clearly say fetal skull bones due to the collapse of cranium. So when some child is died intrauterine, if you do a ultrasound scan, you can see this. Okay. And there's a thing called Robert sign, presence of gas formation within the heart and great vessels. And halo signs, that is scalp edema. And ball sign, there are so many signs. These are all are radiological signs. I really don't know why they asked this question from you, but these are the radiological signs. Okay. There are another 2 or 3 signs also. Gas in the circulatory system and spinal cord collapse. And collapse of the skeleton. Again, same name. So these are the radiological signs of fetal death. So we will provide these notes. Don't worry, you can get it. So you should know about these radiological signs of the fetal death. So when somebody died intrauterine, you can find this. So true or false regarding the radiological signs of fetal death? Overlapping skull bone, true. Gross distension of fetal anatomy, false. There's nothing called like that. Collapse of the spinal cord, of course, true. He has a Spalding sign. This dual sign is, I think we have seen. Again, Spalding sign is there. So these are the radiological signs of, I have to check with this dual sign is there. Yes, of course. These are the radiological. So these all are true. So you have to study this. Radiological signs of fetal death. Okay. Next step. True or false regarding infanticide? Best proof of live birth is full respiration. What is your answer?
False.
False. I already saw it is not a full respiration. It can happen in so many other ways. So it is false. Mosaic appearance of the lung is suggestive of full respiration. Anybody studied about histology of the lungs? What is the mosaic appearance? Mosaic appearance like a marble appearance. It is not related to infanticide. This has some interstitial lung disease. Just CT scan appearance. They unnecessarily put this term here to confuse you. So in the CT scan, you can see the mosaic appearance, diseased lungs. So it has nothing to do with infanticide. So it has no connection with infanticide. Putrefaction can cause positive flotation test. Again, true. You have seen this. Am I correct? So the D, this is very important. Cicatrization of the cord occurs in first week. What is this? Anybody studies this? Infanticide. Cord changes. So umbilical cord changes. If you have seen children in your home, you may experience it. 12 to 24 hours, drying commences at the free end. 2 to 3 days dry. 6 to 7 days complete separation. And 7 to 12 days active scar present. See, these are the umbilical cord changes. So you should remember these things. So 12 to 2, 2 to 6, 6 to 7, and 7 to 12 days. So these are the cord changes. So according to this, in 1 week complete separation. So this same as cicatrization of the cord occurs in 1 week means true. Okay. At the autopsy of an infant, against some important stems, a red ring around the umbilicus indicate that child survived more than 24 hours. What is the answer? Who has studied inflammation should answer this question. So in the inflammation, you may have studied redness occur around 24 hours, no inflammatory reactions. So this is true. Okay, we see redness, then umbilical cord. Dried, shivered, or cold stump indicates live birth. What is the answer? We have seen, just now we have seen umbilical cord. First change is the drying. So it is indicates the live birth. True. Maceration of the skin indicate the exposure to the cold of live born infant. What is the answer? When the maceration happen? When there's a intrauterine death. So it is a exposure to cold environment? No, it's false. Scratch abrasion of the neck is proof of manual strangulation. So we already seen the answer for this. Scratch abrasion in the neck can happen in manual strangulation, but it can also happen in self-delivery, home deliveries. So it is not the proof of manual strangulation. You have to do a dissection and see the injuries on the neck muscles, neck structures. Then only it is a proof of manual strangulation. Is it understandable to everybody? Okay. Full expanded mortal lungs covering the heart indicate the separate existence. So full expanded mortal lungs covering the heart indicate the separate existence. What is the answer? When the lung become mortal and covering the heart, when it expands, when the child breathes completely. So it is true. Okay, next question. What are the injuries which suggestive of infanticide? Macerated fetus, symbol, false. If you see this maceration is coming in almost every year, stems. Superficial burn injuries, true. Mother can kill the child by burn injuries, so it is true. Nail marks on the home delivery baby, again false. Why? Home delivery, self-delivery, nail marks can happen in the neck. It is not the suggestive of infanticide. Multiple fracture of the skull, true. I order if somebody applied blunt force to the head, it can cause multiple fractures. Multiple contusion in limb, again, true. It's indicate the maltreatment. Child has been assaulted. So it is again true. Okay, now we are gradually moving to the next topic. True or false regarding the infant death. Remember here, they ask infant death, not infanticide, infant death. SIDS is considered as a cause of death. So anybody knows about this since? Students, I want you just, what do you think about SIDS? Anybody knows what is SIDS? Sudden infant death syndrome. Okay, that is a separate entity. It has nothing to do with infanticide. So SID is considered as a cause of death is false. Is it clear to everybody? So it has nothing to do with infant death, infanticide. But the stem is regarding infant death. So it's very important. Here it is not infanticide, infant death. It is considered a cause of death. Again, true. Is it clear? It is not infant. If it is infanticide, it is considered cause of death is false. But here it is an infant death, not an infanticide. So it is true. If done by the father, it is never considered as an infanticide. What is the answer? True. Overlying may be an accident. What is overlying? So if you study pediatric cot death, infant death, overlying, when the mother is obesal sleeping with child, she can accidentally overlie the child, which can cause infant death. So infant death can be caused by overlie. It is true. Skull bones overriding the presence of basically exclude the live birth. Skull bones overriding and presence of vesicle exclude the live birth. Here, what is the answer? Very simple. What does they say? They say the maceration. So answer is true. Rigor mortis is rare. Okay. Postmortem changes. Anybody here has studied postmortem changes? What about infant death and rigor mortis? Is rigor mortis prominent in child or less prominent in, or rare in children? Anybody? So children's muscles has less ATP, less energy. So rigor mortis usually less in children. Okay. So now we will see SIDS. Since SIDS also there are so many MCQ in, we will just briefly see the short notes of sudden infant death syndrome and we will see the questions. These are small 3 slides regarding sudden infant death syndrome. So introduction, sudden infant death syndrome is a sudden unexpected death of a apparently healthy infant under 1 year of age, which remains unexplained even after thorough investigation, including autopsy, death scene examination, and clinical history review. So what happened in SIDS? Child within 1 year suddenly dies. But if you do postmortem, you won't find anything. Everything is normal. So then we label it as a sudden infant death syndrome. Common age group, peak incident 2 to 4 months of age. So this is very important for UMC. 2 to 4 months, but less than 1 year. Common age group is 2 to 4 months. Other names of this SIDS is a crib death or cot death. Cot death is famous in the West. So cot death is the another name for the SIDS. So is it clear to everybody? SIDS means unexpected death of a child less than 1 year, usually 2 to 4 months, with all the negative investigations. So epidemiology, if you see, incident varies globally with its higher rate in low socioeconomic people. Sex ratio common in males than females. Again, it is common in male children. Seasonal variation is there, common in winter months. So it is common in the winter season. So risk factors, again MCQ. So I just put the risk factors. There are some infant-related risk factors. Prematurity, low birth weight. These are male gender, recent respiratory infection, genetic predisposition. So prematurity, low birth weight. Children can die suddenly. Male child, recent respiratory infection, genetic predisposition. And there are some maternal risk factors. This is maternal smoking during the pregnancy, young maternal age, poor parental care, and alcohol and drug abuse. These are some maternal risk factors. And environmental risk factors also there. Bed sharing, overheating, prone sleeping, sleeping on the stomach. So, and soft bedding, unsafe sleep environment. These are the environmental risk factors. So these are the risk factors for the SIDS. And pathophysiology, again, I told only hypothesis. We are having only hypothesis because there is no real reason. So we think it's a genetic factor. We think it's an environmental factor. Winter season, child may have bronchospasm and die. We may think it's a brainstem abnormality. We may think some infection or inflammation which we can't undetect. These all are hypotheses, but there's no real reason. So real reason is unknown for SIDS. So how to confirm? How do you prove this? Diagnosis is exclusion. This is a very important term in forensic. What do you mean by diagnosis of exclusion? You do complete autopsy, you do everything, and everything is negative, then we do diagnosis of exclusion. We exclude almost all other foul play, poisoning, natural diseases. Then we diagnose as SIDS. So it's a diagnosis of exclusion. So complete autopsy is an important thing. Brain, heart, lungs, you have to examine. Usual finding is a intrathoracic petechiae. What do you mean by intrathoracic petechiae? In the lungs and heart, there may be blood patches, maybe there. Serogenous discharge from the nose and mouth will be there. Well care for appearance. Usually well care, there's nothing fine. Pressure marks may be there because child is overlying or child is usually negative findings. So only significant findings are intrathoracic petechiae, serogenous discharge. And death scene investigation and review of clinical history usually negative. So this is how we diagnose the SIDS. So what are differential diagnosis? Accidental suffocation. These are DDs, differential diagnosis, overlying, infanticide or neglect, metabolic or over genetic disorders, cardiac arrhythmias, long QT syndrome, or infection, sepsis, myocarditis. These are our differential diagnosis. So once you exclude everything, this is what I told, diagnosis of exclusion. When you exclude all these things, then it's a SIDS, sudden infant death syndrome. So hope you understand SIDS. Now we are moving to the MCQs. Regarding sudden infant death syndrome, common at the 3 months. What is the answer? When is common? What did I say? Commonest at 3 months is force. 2 to 4, no? I told somewhere. There it is. Peak at the between the 2 to 4 months. So commonest in 3 is not true. Okay. Twins are the higher risk. How do you answer this question? Twins are the higher risk. If there are twin delivery, what is the problem? They have a risk of what? Low birth weight, prematurity. So they are at the higher risk. That is true. So sudden infant death syndrome, twins are the higher risk is true because of the prematurity as well as low birth weight. Often seen in the morning. What is the answer? Just think. When does this happen? When the child is sleeping. It is usually happening in the night, not in the morning. Okay, we say no, child go to the sleep and death. So nobody know the reason. So often seen in the morning, again false. Microscopic examination finding are specific. What is the answer? Simple.
False.
Histology false. Why? There's no find. Usually there is no findings. Okay, there's no specific finding in the SIDS. Usually lead to the negative autopsy. What is the answer? True. That's what we studied. So SIDS are usually negative. Okay. Hope you understand. Okay. Sudden infant death syndrome. The autopsy is generally non-specific. What is the answer? Simple, straightforward. True. Common around 3 years. False. It is common less than 1 year and common as 2 to 4 months. The incident markedly higher in pair of twins. Again, same MCQ, no? Yes, true. Why? Twins, they have a high chance of prematurity, high chance for low birth. There are visceral laceration. What is the answer? Is there injuries in SIDS? No. This is false. Okay. This is infant death or infanticide, lacerations. Majority shows intrathoracic petechiae. Again, I told no. Intrathoracic petechiae has a only find, non-specific finding. You will see some blood petechial in the lungs, heart, cervix. So majority shows intrathoracic petechiae, again true. So this is sudden infant death syndrome. Do you have any questions until now? Shall we move to the second topic? Or we will wind up. What is your... Shall we go to the second topic? That is, so we will start in 2 minutes time. We will start in 3 minutes time. Cause of death. How to write the cause of death? That is your practical issue. That you are going, all are going to be a doctor. How to write the cause of death in the death declaration form and WHO format. We will see some practical scenarios. We will see some MCQs. It will take another 1 hour. Okay. 45 minutes, say. We will take 2 minutes, 3 minutes break. Okay. Now we are moving to the cause of death. So we have studied disposal of death that day. If I... So cause of death. When the doctor should declare the cause of death? Anybody? The death declaration from... When do you declare the... When somebody died in the ward, death declaration form should not be filled for any death that will not subject to inquest. So we have studied what are the indication for inquest. Any unnatural deaths or any suspicious death, any post-surgical or post-procedure deaths, you should not fill the cause of death. Other than that, all the natural deaths, unsuspicious natural death, you can fill the cause of death form. So there's a misbelief in Sri Lankans, 24 hours rule. It is wrong. 24 hours, not an indication for inquest. So even there's a 24 death within half an hour, you can fill the cause of death form and release the body if it is natural and cause of death is known. Okay. Why it is important? It's a contribute to the legal record of the death and source of mortality statistics. So it is a very important mortality statistics for the country. So certificate of cause of death. If there's a single cause of death like infection, for example, dengue causes a death, is very easy. But nowadays there's a problem because people have a lot of conditions that can cause death, more than one chronic condition. So you have to analyze this condition and give the cause of death. So there is an international format that is called WHO recommended format. It has a part 1 and part 2. Part 1, immediate cause of death, and part 2 is any condition not directly leading to the cause of death. It is a contributory cause of death. Part 1 is an immediate cause of death with underlying cause of death. Part 2 is a contributory cause of death. So we will see what is the format. This is the format. Over the word, it is there. So immediate cause of death is there. 1A is the immediate cause of death. And it is followed by the underlying cause of death. Immediate cause of death, underlying cause of death. Part 2 is a contributory cause of death. So by seeing this, what do you understand? This patient died immediately due to the congestive cardiac failure within 2 weeks. Time period also there. Why he developed cardiac failure? Due to cardiomyopathy. That is present there for 2 years. Why he developed cardiomyopathy? Due to amyloidosis. That is present there for the entire life. Is it understandable to everybody? So amyloidosis, which is the culprit, underlying cause of death, causes the cardiomyopathy, and which led to the immediate cause of death, congestive cardiac failure. Same time, he has a Paget disease of the skull, which is not a direct cause of death, which is a just contributory cause. It is there in the body, but it doesn't cause the death. It's just a contribute. So this is the WHO form. We will see how it's written in our Sri Lankan form. So remember, when you use, so there are some guidelines for doctors how to write B33 form. You have to write in a legible, very clear form in a black ink. Do not use abbreviation. Don't use HT, DM abbreviation. And you have to verify the name of the disease and don't alter in the cause of death form, which is very wrong. So these are the things, basic guidelines. So now we are moving to the important part, case studies. That is very important for your MCQs and for your day-to-day work. We will see some case study. Just keep in your mind and you are going to answer this question. A 49-year-old male was admitted to the hospital with a history of severe epigastric pain, radiating to back, associated with a nausea and vomiting. History revealed he had a severe similar episode past 4 years. He had 15-year history of excessive alcohol consumption. His X-ray showed pancreatic calcification. Serum amylose very high. The condition was diagnosed as acute pancreatitis. Despite the treatment, he died on third day. So it is very clear. He is a severe alcoholic. 15 years consuming alcohol. Last 4 years, he has a severe episodic pain, which diagnosed as with X-ray pancreatic calcification. What is that pancreatic calcification means? Chronic pancreatitis. This time, he came with the acute pancreatitis and died despite the treatment. Is it clear to everybody? Just reading this. Just take some time and read. So this person is an alcoholic for 15 years. Last 4 years, he is having a chronic pancreatitis. This time he came with acute pancreatitis and died. So how do you write the cause of in this patient? Though this is the cause, immediate cause of death and underlying cause of death and contributory cause of death. This format we are going to write. So this is how you are going to write. Immediate cause of death is a acute pancreatitis due to chronic pancreatitis. Underlying cause of death is a chronic pancreatitis due to chronic alcoholism. There's no contributory cause of death. He has no contributory cause of death. Is it clear to everybody how we write the cause of death? You may think, why I can't write a mechanism of death like electrolyte imbalance, sepsis. Those are mechanisms. Cause of death is a acute pancreatitis. Is it clear to everybody? Any questions on this cause of death writing? Please, you can ask any questions. Is it clear to everybody cause of death writing? So this is the format you have to write cause of death. So MCQs are there, we will see. Okay, so case study 2. Just see this, very easy. A 53-year-old male was taken to hospital with a history of severe hematemesis. He gave a history of several episodes in the hematemesis during the past 4 years and excessive alcohol consumption for 17 years. Liver biopsy was done 4 years ago and revealed cirrhosis of the liver. 2 years ago, he was diagnosed to have diabetes. He was pale and hypotensive and died on the second day. So it is obvious he's an alcoholic for 17 years, diagnosed to have liver cirrhosis for last 4 years, and he died of what? Hematemesis. But hematemesis is a symptom. You can't write the symptom as a cause of death. What is hematemesis? Upper GI tract bleeding. Same time, he has a diabetes. Remember, in a cause of death, you can't write the symptoms as fever. Hematemesis as a cause of death. Jaundice as a cause of death. Is it clear to everybody? You have to write the disease. So how do you write the cause of death? Gastrointestinal hemorrhage for 2 days due to cirrhosis of the liver. 4 years due to alcoholism for 17 years. And he has a diabetes, which is a contributory cause of death, which is not directly caused the death for 2 years. Is it clear to everybody? Any questions? Sure, no questions. Okay. This is a third case. Just to 75-year-old male was admitted to the hospital complaining severe chest pain. He had a 10-year history of chronic ischemic heart disease with an ECG finding of myocardial ischemia. 5 months before, on admission, he was found to be anemic and found to have mass in the cecum. Later, it was diagnosed as a carcinoma. surgery was not done because of the age and medical condition. This time, ECG showed exchanges reflecting extensive anterior myocardial infarction and died on the second day of admission. He died on the second day of admission due to extensive anterior myocardial infarction. So, immediate cause of death is clear. What is that? Myocardial infarction. But he has a 10-year history of chronic ischemic heart disease. And he was later diagnosed to have carcinoma of the cecum. So how to write the cause? There are so many conditions. How to write the cause of death? So immediate cause of death is acute anterior myocardial infarction. 2 days due to chronic ischemic heart disease. Again, carcinoma of cecum is a contributory cause of death. Is it understandable to everyone? It has no direct relationship to the death. Is it clear to everybody? Okay. So here some of the wrong cause of the death I am showing from hospital center. Immediate cause of death, COVID pneumonia with ARDS with ventilatory associated sepsis. What is the wrong here? What is the wrong? Okay, somebody has asked anemia. Right, we will move to the first one. Somebody has asked here anemia. So anemia is a what? Here, do you think anemia of the due to cecum bleeding can cause ischemic heart disease? Theoretically, you may say, but of course, in reality, anemia never caused the ischemic heart disease. Okay, and he has developed anemia when? Only for the last 5 months. Okay, but he has a chronic ischemic heart disease for 10 years duration. So this acute myocardial infarction due to chronic ischemic heart disease, not due to the anemia which developed within last 5 months. So that's what it is, not a immediate cause. It is not an underlying cause. Carcinoma cecum is a contributory cause of death. Hope you understand. Okay. Now we are moving to the real life situation. What is the problem here when you write cause of death like this? You are writing a competing cause of death. Can you see COVID pneumonia with ARDS with ventilatory associated sepsis? There are 3 cause of death is there. COVID death, ARDS, ventilatory associated sepsis. Competing cause of death is there. Nobody knows when, due to what patient died. And the order is wrong. According to this, COVID pneumonia caused by ischemic heart disease. You can see consequence, immediate causes, underlying causes ischemic heart disease. Is it true? Ischemic heart disease never caused COVID pneumonia. And you can see there's a small gap and bronchitis. So this is garbage. I mean, this is a very wrong setup. So even though we are teaching, once you become doctor, you write cause of death like this. So remember, you are not supposed to write cause of death like this. So this is the way. Sepsis due to COVID pneumonia, ischemic heart disease and bronchial asthma is the contributory cause of death, the immediate cause of death. So this is the wrong way to write. This is the correct way to write. Sepsis due to COVID pneumonia. Okay. Again, another COVID pneumonia with ARDS sepsis, diabetes mellitus due to diabetes, due to hypertension. So according to this way of writing, hypertension causes diabetes, diabetes causes the COVID pneumonia with ARDS and sepsis. So you will understand, no, what is the wrong they have made. So this is not the way. Sepsis due to COVID pneumonia, diabetes and hypertension. Again here, severe cardiogenic shock due to left ventricular failure, due to hypertension, cerebrovascular accident, troponin positive acute coronary syndrome. Again, you can't write the shock as a cause of death. It's a symptom. Shock is a symptom. Of course, you would have write left ventricular failure, but shock, cardiogenic shock is a symptom. So you can't write the cause of death. So how do you write? Left ventricular failure due to acute myocardial infarction. And patient has hypertension and cerebrovascular accident. Is it clear to everybody? Left ventricular failure due to acute myocardial infarction, hypertension, cerebral accident. This is another cause of death which is correct. Severe sepsis due to left lower limb infected wound. And 2 is a type 2 DM. Again, there's a mistake. You can't write the abbreviation. DM, ischemic heart disease. These things you should avoid. But in a way, this is correct. Severe sepsis, left ventricular, left lower limb infected wound. Okay. Again, this is a correct way. Aspiration pneumonia with recurrent CVA. Again, due to recurrent CVA, it should come here. Again, CVA, you can write CVA. Diabetes mellitus, type 2 Parkinson, diabetes mellitus, type 2 Parkinson's disease. Something. Okay. These are, in a way, little bit correct cause of deaths. Okay, now we are moving to our important thing, MCQs. Now you have little idea about cause of death, WHO format. You may have studied earlier. Now we are moving to the MCQs. Cause of death can given cause of death for cirrhosis. You are going to answer this. Hepatic encephalopathy, true or false? Cirrhosis, can you give hepatic encephalopathy as a cause of death? Of course, true. People can die of hepatic encephalopathy. So true. Portal hypertension, of course, true. Portal hypertension cause upper GI bleeding and true. Jaundice, any answer? Can you give cause of death as a jaundice?
False.
False. It's a symptom. It is not a cause of death. Okay. Ascites. Can you give?
False.
False.
False. It's a symptom. Variceal bleeding. Of course, you can give variceal bleeding. You can give a cause of death as a variceal by we already seen. Okay. So you understand, no? This is the MC. Which of the following are accepted as an immediate cause of death according to WHO? Okay, we'll see this. Cardiorespiratory failure. Can you give cardiorespiratory failure? We have a bad habit of giving cardiorespiratory failure. Everybody died of cardiorespiratory failure, final stage. So it is a mechanism. You can't give as a cause of death. Remember. Myocardial infarction, true. You can give as a cause of death. It's a cause of death. Hanging, of course, true. Hanging is a cause of death. Remember, you can't give a suicidal hanging. Why? Suicide is a manner of death. But hanging is a cause of death. So you can give hanging as a cause of death. Road traffic accident, again, accident is a manner of death. You can't give road traffic accident as a cause of death. It's a manner of death. Road traffic trauma you may have, but accident is a manner of death. You can't give. Bronchopneumonia, of course, you can give a cause of death. So is it clear? Cardiorespiratory failure mechanism you can't give. Myocardial infarction, of course, is a cause of death. Hanging, cause of death. Remember, but suicidal hanging you can't give. Road traffic accident, again, problem is a manner of death. You can't give accident as a cause of death. Bronchopneumonia, you can give a disease. It's a disease you can give a cause of death. Is it clear to everybody? Okay. Okay, this is again very important MCQ. 1A is the regarding cause of death certificate. 1A is the immediate cause of death. What is the answer? True. We have seen,
True.
no? Cardiorespiratory arrest is the commonest immediate cause of death. Again, I told in Sri Lankan context, everybody write cardiorespiratory is false. 2 is an underlying cause of death. Now it's problem. What is underlying cause of death? Is it a 2 or 1? The section 201 underlying cause of death is there.
1B.
1B, no, very good. So you have seen here, no, immediate cause of death 1. 1B is a underlying incidental or underlying cause of 1BC. It's a consequent. 1 is immediate and underlying. 2 is the contributor. Here it is, just you can see here, left side. Okay, immediate cause of death with underlying cause of death 1. 2 is a contributor. So you may have now understand. Underlying cause of death, false. 1B is a contributory cause of death, again false. Issued by the intern medical officer, of course, once you have registration, in Sri Lanka, you are issuing the death certificate. Okay, final question. 25-year-old non-patient with diabetes and dyslipidemia have a developed sudden onset of chest pain radiating to back. On admission, ECG showed changes suggestive of acute myocardial infarction. During the treatment, he developed hypotension, bradycardia, and cardiac arrest. He died within 4 hours of admission at the emergency unit. So, 65-year-old patient with a diabetic and dyslipidemia come with a chest pain, ECG, acute myocardial infarction, hypotension, bradycardia, died within 4 hours. Okay. Now we will see. Inquest must be ordered as the death occur within 24 hours of admission. What is the answer? Anybody?
False.
False.
False. Very good. Here, cause of death is there. Cardiac arrest is the immediate cause of death. Again, false. I told it is not an immediate cardiac arrest. Is a everybody died of cardiac arrest. You should not give cause of death as a cardiac arrest. Here, myocardial infarction is the cause of death. Acute myocardial infarction. Myocardial infarction is an incidental cause of death. What do you mean by incidental cause of death? Is it an incidental cause? No, it is the immediate cause of 1A, immediate cause. It is not the 1B, immediate cause of death. Diabetes is a contributory cause of death. What is the answer?
True.
Cause of death cannot be given by the treating doctor if the relatives give alleged incident of assault prior to the onset of chest pain. What is the answer? Relative saying he was assaulted by the girlfriend or boyfriend. So, sorry, relatives, another relative. Can you give a cause of death when somebody says it is a suspicious death? Now, you understand? There's a history of violence before the death. So, in that case, you can't give the cause of death. Okay, you have to order for inquest. So, cause of death cannot be given by treating doctor if the relatives give alleged incident of assault prior to the incident of chest pain. Of course, true. That's why all the natural deaths, this is only natural deaths only you can give the cause of death. When there's a suspicious, you can't give the cause of death. Is it clear to everybody? Did you understand this? When there is a death with a suspicious, you can't give a cause of death. That is the take-home message. So that's all. Thank you.